Welcome to the Graves Recovery Camp show, where vibrant health is a way of life. I'm your host, Jen Danielle. I'm a real person healing my own Graves' disease with conventional and functional medicine. And now I guide other people to do the same. Are you ready to learn more about healing your Graves' disease? All right, let's get started. At Graves Recovery Camp, your wellness is very important to us, and every care has been taken to bring you the best content to help you achieve your wellness goals. Content from Graves Recovery Camp in no way constitutes medical advice and is not intended to be a substitute for medical advice, diagnosis, or treatment. Always seek the advice of your qualified healthcare providers with any questions you may have regarding a health condition. We also advise you to consult with your healthcare team before changing your diet or lifestyle. Never disregard professional medical advice or delay seeking it as a result of the use of this site content. We make no guarantees about your experience or results from use of our content. You are using this content at your own risk, and you release Graves Recovery Camp, its officers, employees, and consultants of any liability relating to your use. Hello, everyone, and welcome to another episode of the Graves Recovery Camp show. I am Jen Danielle, your fearless host, and today we are going to be diving into radioactive iodine therapy for Graves' disease. Now, this treatment goes by many different names. You might hear radioactive iodine, RAI treatment, and also sodium I-131, but they all mean the same thing. This is one of the conventional treatments that is irreversible, that is used to treat Graves' disease. It was developed in the early 1940s and has been one of the main ways that Graves' disease is treated. And today I want to demystify what it's all about and what the procedure is like, so that if you are considering it, it is not as scary as you think it is, though I would highly recommend that you try other treatments before you go after this irreversible one. But in some cases, this is what you need to do for your body, so please listen to that body of yours. It probably is talking to you, telling you something. But for today, we are going to learn all about radioactive iodine therapy. So this is something that you want to be very prepared for. I'm sure your physician will prepare you, but this will give you an overview of what is going to happen so that you can ask your endocrinologist even better questions. So first, what is radioiodine or radioactive iodine? Now, this is a form of radiation therapy that has been used for many years to treat a lot of thyroid conditions. It's safe and effective, but you do need to observe certain precautions to decrease the small amount of radiation that other people may receive from your body after you have RAI treatment, radioactive iodine treatment. So, how long does radioactive iodine stay in your body? This is only going to stay in your body for a short time. It goes through most of the radioactive iodine that does not go to the thyroid tissue will just be eliminated from your body in the first few days after treatment. And it leaves your body in just the normal ways we have things leave our body. So it will go out through your urine, through your saliva, sweat, and also your bowel movements. So that will get excreted from your body. How can you reduce your radiation exposure to other people? Now, this is going to be key because your thyroid is what you're trying to attack with this radioactive iodine, but you don't want other people to have this radiation. So you can reduce this risk to other people by keeping yourself away from other people after you have the radioactive iodine treatment. And your physician is going to review all of the instructions with you, but just know that you are really going to have to prepare for this treatment. So that will mean making sure that your schedule is such that you will be isolated for at least a week, that you're not with other people. You also want to make sure that you're not traveling anywhere. I mean, that puts you into, if you're flying into an airport, then being around other people. So those are things that you don't want to do, because you could, actually, when you're walking through the metal detector, you could set that off first, but then also there's just a risk to other people. If you're touching something and then they're touching it, they could pick up that radioactive exposure from that. Now, getting ready, what you're going to do is you're first going to stop taking, if you are taking any of your anti-thyroid medications, you're going to stop that anywhere from 3 days before to a week before, depending on what your physician is wanting. But many people do 5 to 7 days before, but at least 3 days before. Then you're also not going to eat or drink anything after midnight on the day of the procedure. So once the day of the procedure hits, you're going to go to the place where you're going to have this radioactive iodine administered. And this has a lot of process around it because of the risk of exposure of radiation. So you will go to an office or a clinic where you'll go in. You'll most likely have a blood test, because they'll want to know where you're at prior to the radioactive iodine, all your levels. And then you'll go into a room, probably with a radiologist, and they will give you a small pill that then you will take. And that's it. Now you have the radioactive iodine. The next thing that you need to do is get yourself into somewhere where you're going to be sequestered alone, making sure that you are not exposing other people. So when I was getting ready for this, my physician recommended that I reserve a hotel room for 7 days right after the treatment. Now, another thing that I just found very interesting with this treatment is that the radiation is prepared by having 2 different capsules that the person preparing the medication will have, and they take that and put the medicine from one capsule into the other, and then they close it up and making sure it's the right amount, and then they put it in a plastic container, and then they put that into a lead container. And once they do that, it is only good for 7 days, because it is radioactive and it's going to be decaying over those 7 days. So if you're interested, I would ask, when was this medication prepared, so that you know it is fresh and going to do what it needs to do, especially if you're taking all these precautions in order to have this radioactive iodine administered. All right, so where we are is you've taken the medication, and now you're getting yourself from the place where you had it administered to the place where you're going to be for the next 7 days. I would suggest that you don't take a taxi or an Uber or anything like that. You want to make sure you're in your car, so you know that you're not exposing anyone else. And then after this is all done, you can clean that car and make sure that everything is removed from that car. All right, within the first 8 hours after your treatment, you're going to stay hydrated. You're going to drink a lot of water. Make sure you're drinking at least 1 glass of water each hour, and use the bathroom as much as possible. But this is very graphic, and I apologize, but go slowly. What you want to avoid is splashing anywhere. So because once you start splashing, that could be radioactive iodine that you're just getting back out into the environment. You want to make sure that you're staying at least 3 feet away from all people. This means that if you check into a hotel, I would I would perhaps check in before you go to have the treatment so that you can just walk straight in, use some gloves if you need to, press the elevator, and just think of anything that you're touching. You could be leaving radioactive iodine that could be picked up by someone else. So certainly don't use public transportation to get yourself in between the facility and your hotel. But just make sure that you are looking out for others. The next 2 days, you're going to make sure that you're not, if you're alone in a hotel, it's very easy, but if you are with your family or you're in a place where you live alone, make sure that you're not sharing any cups or glasses or anything with anyone else. Make sure you're washing those items promptly after using them. Don't share any kind of towels or washcloths. And when you are using the toilet, flush the toilet twice after you use it. Sometimes not everything goes down on that first flush. You want to make sure that everything is flushed. So flush the toilet twice in those first 2 days. Then for your clothing, there are a couple of different approaches you can take here. You can wash it immediately, or you can just put it in a bag and let it sit for 2 weeks. So what's going to be happening is that radioactive iodine that's there is going to be decaying. So it will not be as powerful after those 2 weeks, if at all. And then you wash it, and please wash it separately. If you do have small children, make sure that they are taken care of, not by you, and especially babies, not being around any sort of baby or infant. That could be extremely detrimental to such a small being. Next, within the first week, you might notice tenderness and swelling in your neck, and you might have pain when you swallow, and you might have a sore throat or cough after the 3rd day. So just know that that could be something that you experience. You also might have some of the other side effects, and those are being nauseous, just not feeling well, vomiting, having chest pain, also having your heart race. Then some people also experience itchy skin, rash, and hives. So those might be some of the side effects that you experience, but just know that those may go away as you progress through that first week. Again, if you're not staying in a hotel, make sure you're sleeping alone, and then after you are sleeping, that you're washing those sheets. Make sure you're avoiding kissing or any physical contact with anyone. Stay at least 3 feet away from anyone. So that time when you're going from the office where you had the treatment to your hotel, just make sure you're staying at least 3 feet away from people, and be very conscious that you could transmit this to others. Some people say, well, what if I just went to a movie theater to pass the time? And that's not a good idea either, because you could be transmitting this radioactive iodine onto other people. All right, other things that you should know about. I did mention that you may trigger radiation monitors at airports, or anywhere where there are radiation monitors, government buildings, hospitals, waste disposal sites even have them for up to 3 months after your treatment. So just know that if you're going through any kind of detector, that you might be setting it off, even if you don't have your keys in your pocket or something like that. It's just something to be aware of. All right, that wraps up the deep dive on radioactive iodine therapy. I know that that's a lot, and it is quite a process, but just think about what you're doing to your body here. You are removing your thyroid with this very interesting approach. It is also irreversible. Once your thyroid is gone, it does not grow back, and most likely you will become hypothyroid, And with that, you'll be working with your endocrinologist to make sure you're controlling that so that you're not having those symptoms. But this will most likely be a little bit of a roller coaster as you come out of that and get your body stabilized again. All right, with that, we will wrap up. If you have any questions about this treatment or how your Graves' disease journey is going, what you can do to start on a path to healing, please go to gravesrecoverycamp.com. There are a lot of resources there. There is also a membership community where you can get the courses and coaching for your Graves' disease, because with Graves, you do need support. One of the features of Graves is that sometimes people don't think clearly, and they need that help. They need that push to know that you can control this disease, you can get the upper hand on it, and if you start treating your body in the way it needs to be treated, you can make significant strides with your Graves' disease. So if any of that sounds good to you, go over to gravesrecoverycamp.com. I would love to help you. I appreciate you listening. Thank you so much, and have a great day. Bye. Were you recently diagnosed with Graves' disease? Are you feeling pressured to remove your thyroid? You may feel alone, where no one understands what you're going through, but I'm here to tell you there is hope. I believe with the right care and support, you can keep your thyroid, which is the reason for Graves Recovery Camp. It's a community-driven, step-by-step process designed to help you on your road to recovery. Graves Recovery Camp provides the guidance and support you need to mobilize your healthcare team and get better. If you believe that keeping your thyroid is the best choice, we would love to help you do just that. Head over to gravesrecoverycamp.com to join. Hi, it's Jen again. Just one more thing before you take off. Would you enjoy getting a few ideas on the gear you need to get your Graves healing journey started? Just head over to gravesrecoverycamp.com/gear guide. That's gravesrecoverycamp.com/gear guide. Drop in your email and you'll get your gear guide delivered to you. If you sign up, I hope you enjoy it.